Remember those awkward years we all had, with a mouthful of metal braces? It seemed like every kid had them.
Right.
But today, we're not just taking a trip down memory lane, are we? You've been digging into ways to afford braces specifically. Could Medicaid actually help? And you know what? That's smart.
It is.
This isn't just about getting a picture-perfect smile.
Yeah.
It's about getting access to important health care.
Exactly. And to really understand that, we need to grasp how Medicaid actually fits into the world of dental care.
Okay.
So it's set up to help low-income families with their healthcare costs, and yes, that includes dental care for their kids.
Makes sense.
In fact, that's a requirement at the federal level that dental care for kids is covered. But, and this is a big but, the coverage usually kicks in for what's deemed medically necessary, not just for cosmetic reasons.
Medically necessary? That makes sense, but I can already see where things might get a little tricky, right?
Oh, absolutely.
So we're talking about those cases where straight teeth are actually vital for your health, not just, wanting a dazzling smile.
Exactly. Think about a severe overbite that makes it difficult to even chew properly,
Oh, right.
or a child with a cleft palate that impacts how they learn to speak.
Yeah, that makes sense.
Maybe a jaw injury that's affected tooth alignment, or
Right,
even birth defects that impact oral health.
right.
Those are situations where Medicaid is much more likely to step in and provide coverage.
So it sounds like the cause and effect on someone's health need to be pretty crystal
Yeah.
clear. Now, I was looking through those articles you sent over, and one thing that stood out was how Medicaid actually handles this. It seems to change quite a bit from state to state. Is it really that complicated?
You hit the nail on the head. Medicaid programs are actually managed at the state level.
Oh, okay.
So the federal government, they lay down some ground rules,
Right.
but each state gets to decide what they consider medically necessary when it comes to orthodontic care.
Yeah.
And honestly, that's where the real challenge begins.
So, for our listener, just because you see the words medically necessary doesn't necessarily mean it's a slam dunk.
Right.
Okay, let's say we have two people, both dealing with a pretty intense overbite, but they live in different states. How could their experiences with Medicaid coverage actually be different?
Okay, so let's imagine one person lives in Texas and the other's in North Carolina. Both states use this term malocclusions.
Catchy.
I know, right?
Yeah.
It's a fancy way of saying your bite is misaligned.
Right.
Now, Texas, they tend to be on the stricter side, reserving coverage for what they call a severe handicapping malocclusion.
Wow.
That means the overbite has to be very serious, significantly impacting the person's life. We're talking about a child whose severe underbite makes it impossible for them to bite into an apple or chew their food without serious difficulty. That's more likely to be considered handicapping in Texas.
So it's not just, oh, you have some crooked teeth. It's how is this actually impacting your ability to, get through the day?
Exactly. Now, North Carolina, they use this phrase, functionally impairing malocclusions. On the surface, it might sound a little broader, right? They might consider covering an overbite that affects a child's speech or causes them significant discomfort, even if they can still manage to eat most foods.
So even if the description seems similar on paper, the reality of getting Medicaid to actually cover braces can be totally different depending on your zip code.
Exactly. And even with that seemingly broader language in North Carolina, there are cases where people, even when their orthodontist believed braces were necessary, were denied coverage.
Wow.
And in Texas, some orthodontists have said getting Medicaid to cover braces is quite uncommon.
Wow, that's really surprising. So I bet our listeners thinking, okay, this is a lot. What do I do with this information? This is complicated.
The most important thing is, do your research. Don't assume anything. Just because you read a general description online doesn't mean it guarantees coverage in your specific situation. Honestly, the best thing you can possibly do. Find a local orthodontist who actually accepts Medicaid and schedule a consultation. They will be up to date on your state's specific requirements, and they can give you the most accurate information for your unique situation.
It's like getting a personalized roadmap instead of trying to navigate with just a gas station map from 10 years ago.
Exactly.
Find an expert who speaks Medicaid in your state. Now, for families with kids, are there other programs worth considering besides traditional Medicaid, maybe as a backup plan?
Definitely. Look into the Children's Health Insurance Program, or CHIP if your state offers it. CHIP is designed for those families who might earn a bit too much to qualify for Medicaid, but are still struggling with healthcare costs.
So it's like a safety net for those who fall through the cracks.
Exactly.
I like it. Okay, let's say someone's exploring all their options, whether it's through Medicaid, CHIP, or even private insurance. they're going to be thinking about the cost. And let's be real, braces aren't cheap.
They're not.
What's the price tag we're actually looking at here?
You're right, it's a significant investment. On average, the cost of braces in the U.S. without insurance is around $6,000.
Okay.
But keep in mind that's just an average. The actual price can range from about $2,000 on the low end to over $10,000 in some cases.
Wow. Okay, so that's quite a range. What actually causes those price differences? Is it simply about the type of braces you get? Like, are we talking about those clear ones versus the traditional metal ones?
It's easy to assume it's just about the materials,
Right.
but there's actually a lot more to it than that.
Okay.
A major factor is actually the orthodontist's expertise, their experience level.
Oh, okay.
It's kind of like any other field,
Yeah.
You're paying for their years of specialized training, their skill set.
Right, so you're not just paying for the braces themselves, you're paying for the knowledge and skill to apply them and then adjust them over time.
Exactly.
What other factors kind of play into that final cost?
The complexity of your case.
Okay.
Someone with more complicated alignment issues might need braces for a longer period, which of course means more appointments, more adjustments, and ultimately a higher overall cost. And believe it or not, even your location can influence the price.
Oh, interesting.
Just like the cost of living varies from place to place, so do dental costs in general.
Yeah,
Yeah.
so living in a big city might mean paying more for those pearly whites to be straight.
Okay.
That makes sense.
Yeah.
Now, you mentioned operating costs for the practice itself. What does that actually include, and how does that play into the cost of braces?
Right, because orthodontists, they have business expenses just like anyone else.
Right.
So we're talking about rent for the office space, the cost of all that specialized equipment, salaries for the staff, and of course, staying compliant with all the necessary regulations. All those overhead costs have to be factored into the overall price of treatment.
Okay, so we've covered that whole medically necessary aspect and the fact that costs can really vary. But let's be realistic. What happens if someone needs braces, Medicaid denies coverage, and they're stuck staring down a $6,000 bill? For most families, that's not exactly a drop in the bucket. What are their options?
You're right, it's a significant chunk of change. But even without Medicaid, there's still hope. Many orthodontists offer payment plans, which allow you to spread that cost out over a longer, more manageable period.
Okay, that's a good starting point.
Yeah.
Are there other avenues they can explore?
Absolutely. There are some amazing nonprofit organizations out there doing fantastic work in this area.
Really?
Smile for a Lifetime and Smiles Change Lives are two that immediately come to mind.
Okay.
These organizations are focused on providing braces to children who wouldn't otherwise have access to them.
That's amazing. What a lifeline for many families, I bet. Are there other options worth exploring?
Definitely. Don't rule out dental schools.
Oh, right.
Many dental schools have clinics where dental students, always under the supervision of licensed dentists and orthodontists, can gain practical experience.
So it's like getting a haircut at a cosmetology school, but for your teeth.
Exactly.
And I'm guessing it probably costs a lot less.
You're right. Costs at dental school clinics are usually significantly lower, often about 2/3 of what you'd pay at a private practice. Another great resource is community health centers.
Oh, right.
They receive federal funding, and they often offer a range of dental services, including orthodontics, at greatly reduced costs.
This is encouraging. It's so easy to feel deflated when you see those prices, but it sounds like there are resources out there if you know where to look.
Absolutely.
It's like a whole hidden menu of affordable dental care instead of I'm loving it, I'm intrigued. But before we dive into that, let's take a quick break. We'll be back right after this to uncover even more ways to make braces more affordable. It's like a whole hidden menu of affordable dental care. Instead of I'm loving it, I'm intrigued.
Right.
But it's not just income requirements, right? There are other things that might make someone eligible for these programs.
Exactly. Each program has its own set of rules, its own eligibility criteria, like Smile for a Lifetime. They mainly focus on children and teenagers.
Yeah, okay.
So naturally, there are age limitations.
Right.
And they may have income requirements as well, or even serve only certain areas.
So even if one program's not the right fit, another one might be. You really do have to do your research.
Absolutely. And Smiles Change Lives, for instance. They look at financial need, but they also have an application and review process, and they factor in how severe the actual orthodontic problem is as well.
So you can't just like show up and be like, hey, I need braces. This takes some real effort.
It does.
Speaking of effort, what's the best way for our listener to even find out what's available, what resources are in their backyard?
Yeah.
These aren't exactly, big name organizations.
You'd be surprised at what a simple phone call can do.
Okay.
Reach out to your local health department.
Good idea.
They often have information about local resources. And of course, don't forget about the power of a good old-fashioned web search.
Oh, yeah.
Dental clinics, community health centers.
Yeah.
In your area, you might be surprised at what you find.
I'm a big fan of those hidden gems. Okay, so we've covered Medicaid, CHIP, payment plans, nonprofits, dental schools, community health centers. That's a lot.
It is. Anything else crucial to know about these alternative routes to affordable braces before we move on?
Well, it's important to keep in mind that each option comes with its own pros and cons, right?
Right.
For example, with those nonprofits we talked about.
Yeah.
Even if your application is accepted, there might still be some out-of-pocket costs, like application fees.
Okay.
Or you might be responsible for some portion of the final cost.
Right.
And with those dental schools, while the cost savings can be significant, there might be longer wait times for appointments.
Right, because everyone loves a deal.
Right.
So it's about weighing the pros and cons,
Exactly.
really considering your needs, your circumstances.
And never underestimate the power of asking questions.
The more you understand about a particular program, a specific organization, the better equipped you are to make the best decision, right?
Knowledge is power, especially when you're dealing with these systems, which can sometimes be confusing. Now, it's pretty clear at this point. Getting braces, whether it's through Medicaid or another avenue, isn't one size fits all.
It isn't.
It takes research, persistence. You got to know what you're doing. So for our listener out there who's just beginning to explore these options, what's the big takeaway? What do they need to remember?
The most important thing, remember, there's no single solution that works for absolutely everyone.
Right.
Each state, each program, even each individual orthodontist will have their own little quirks, their own ways of doing things. So don't go making assumptions.
Right. Don't assume anything.
Become your own advocate.
Yes. I love that.
Start by finding an orthodontist in your area who accepts Medicaid and schedule a consultation.
Okay.
They can assess your specific needs, walk you through all the options that pertain to your state, and help you figure out the absolute best path forward.
It's like having a dental care Sherpa guiding you through all the, ins and outs of everything.
Exactly.
But let's zoom out for just a sec.
Okay.
Beyond just the, logistics, the mechanics of getting braces, why does all this matter so much? What's the impact of making sure people have access to this type of care, especially children?
That's a great question. And honestly, it goes way beyond just having straight teeth.
Okay.
It's about overall health, well-being. When your bite is out of whack, it can mess with your ability to chew your food correctly.
Oh, right.
Which, down the road, that can lead to digestive issues.
Wow.
It can impact how you speak, how well you sleep, even your self-esteem.
Right. It's all connected. We often think about dental care as separate from our overall health, but it's really not.
Exactly.
Yeah.
And for kids especially, addressing those issues early on can head off even more serious problems as they get older. It's about setting them up for a lifetime of good oral health.
Right. And all the good stuff that comes with that.
Exactly.
And everyone deserves that, right? A healthy smile, the confidence that comes with that.
Absolutely. Access to quality dental care should be a right, not a privilege.
It should be.
No matter your income, no matter your background, it's fundamental.
That's a powerful statement. It sounds like we're moving beyond just the, nuts and bolts of braces and into this larger conversation about equitable access to healthcare.
We are.
But before we, really dive into that deep end, let's transition to the final part of our deep dive. We've covered so much ground, from Medicaid to all those alternative options, and it's easy to feel a little, overwhelmed.
It can be a lot.
So, as we wrap up, what's that one piece of advice, that nudge to send our listener off on the right foot?
Don't give up.
Okay.
Navigating the healthcare system, especially with cost as a concern, it can feel like a real uphill battle.
It can.
Just remember, you're not alone in this. There are resources out there, people who get it, and options you haven't even discovered yet.
Right.
Start with that phone call. Make that appointment. Ask those questions. You got this.
I love that, remembering we have the power to advocate for ourselves and our families. And you know what? Sometimes taking that first step is the hardest part. But imagine our listener a little way down the line, feeling good knowing they've explored every option.
Exactly. It's empowering to know you've done everything you can to make an informed decision for yourself, for your family.
So to our listener out there, we are cheering you on every step of the way. And hey, Who knows, maybe someday soon you'll be flashing that confident, healthy smile you've always wanted. Until next time, keep diving deep, keep asking those tough questions, and keep believing in your power to make a difference.